What is the HealthyCloud project?
HealthyCloud is a 13-month EU-funded coordination and support action that kicked off actually this year in March 2021, and it will go until end of August 2023. Its principal aim is to prepare the strategic agenda for establishing a pan-European health research and innovation cloud and make sure that it includes the views of all the relevant European actors. So the project has some objectives. So apart from including the voices of the stakeholders, we would also like to include ELSI aspects, so ethical, legal and societal issues in the design of the HRIC, of the Health Research and Innovation Cloud. But we would also like to ensure that we have sustainable access, use and reuse of the health data by progressively adopting the FAIR principles, and make sure that we have the most appropriate technological solutions in place to make this happen. So, for example, have the computational power in place when needed, and also make sure that we have the distributed data analysis for the health data in place.
What is the strategic interest of HealthyCloud?
The objective is to prepare the strategic research agenda for the Health Research and Innovation Cloud, which is the instrument for open science in health research as part of the European Open Science Cloud, dedicated to health research data sharing and secondary use under the General Data Protection Regulation and also under the European Health Data Space Regulation. The Health Research and Innovation Cloud will include a protected environment to store, to share, and to process the health research data.
How is ECRIN contributing to HealthyCloud?
Actually, HealthyCloud involves 21 partners from 11 European countries, and some of them are ERICs, like ECRIN, like also BPMRI, EATRIS, Elixir are contributing to the project. ECRIN has a very strategic role as the Work Package 8 leader, and Work Package 8 is tasked with preparing the strategic agenda for this Health Research and Innovation Cloud. So we are the ones that need to crystallize the different voices of the stakeholders into concrete requirements for this Health Research and Innovation Cloud. So actually we kicked off the activity this spring by first organizing a big workshop, a big joint workshop with other big projects and initiatives that aim to make cross-border health data sharing a reality. So we invited the leaders of EOSC Life, of B1MG, PIRI and TEDA's joint action to have a common discussion with HealthyCloud and identify ways to tackle common challenges. This workshop was attended by more than 100 participants from all over Europe, and it gave us an initial idea on how we can start progressing on our task. And to make sure that the outcomes of this workshop can be broadcasted even more to a wider audience, we also attended one of the biggest e-health events this summer, the eHealth Summit Portugal.
What is planned for the coming year in the HealthyCloud project?
In 2022, ECRIN has under its responsibility one of the most important deliverables in the project, which is to provide the first draft of the strategic research agenda. So for this, we need to get into the discussions with the consortium partners, the work package leaders, and try to align our visions. As a first step, ECRIN has provided a discussion paper to facilitate this process of feedback collection within the HealthyCloud consortium. And we are expected to give actually the first version in October 2022. Then this first draft of the strategic agenda will be refined in a series of workshops together with thematic stakeholders that can help us address issues such as the legal uncertainties that we face, ethics and trust, metadata and findability, data quality and interoperability, also how to choose the technical infrastructure, and how to address aspects on sustainability. So the ultimate aim of ECRIN will be to actually include this input and provide the last version of the strategic agenda for the Health Research and Innovation Cloud as the final project outcome in 2023.